Hey everybody, it's your host, the Ostomy Guy. We've been listening to everybody else's story and I've been kind of hiding from it. But the time is here. My story's out. The Ostomy Guy story, Memoirs of a Bagman. Finally published and ready to buy. www.amazon.com. Go buy one for yourself and one for a loved one. You won't regret it. Hey everybody, thanks for joining us. This is the Ostomy Guy, Austin Powers. We're here today talking about what it's like dealing with and living with some sort of a major illness. And today I have the awesome opportunity of sitting down with a good friend, Mark, and he's going to tell us a little bit about his story, but we're going to kind of talk a little bit back and forth on how our need to be constantly self-aware of what's going on with our bodies, or the environment we live in, and how that affects how we take care of ourselves, how we manage our illnesses, and ultimately how we maintain a level of sanity in regards to dealing with the disease that we carry. And thank you very much for joining me, Mark. I really appreciate you being here.
Austin, thanks for having me. I'm thrilled to be here with you too.
So a little bit about Mark for everybody who's listening. Mark is a clinical psychologist for treating people with type 1 diabetes. And he's been doing that for the last 7-8 years or so. And uniquely, he also has type 1 diabetes. He was diagnosed when he was 21 years old and has been carrying that since then and doing it well, as well as treating patients and managing cases of people with all kinds of different levels in their experience with having that illness. He is married and has a young little baby girl who's about 6 months old. So congratulations, Mark. That's awesome.
Thank you.
And so he's got quite a bit of experience, and he's got some really good case knowledge that he can kind of tap into that'll help us kind of see a little bit more into the dynamic of people with type 1 diabetes. So thank you very much, Mark. I'm really glad to be sitting here with
you. Yeah.
So, all right, so tell us a little bit, and for everybody out there, whether you know or not, Mark and I have already done this once. And we went and did this entire conversation one time, and I didn't hit the record button on the interview, and so it was just a wonderful conversation that was floated off into the wind and stayed between the two of us, which is exactly the reason that I wanted to start the podcast, because I didn't want these conversations to just stay between two people. Word needs to get out. So,
and luckily, Austin, I see the record thing going in the top left-hand side of my screen, so I know that we're good to go right now.
That's
we don't have to do this again.
Oh my God. I'm tired of seeing you, man, honestly. Hey, so go ahead and tell us a little bit about what was going on in your life up to, when you were diagnosed at 21. Where were you? Were you in school? What all was kind of going on?
Yeah, so I was when I was diagnosed, it was June the 1st, 1999, day I'll never forget. But I was at the end of my third year of college at UCLA, and I just got real sick. That I got the classic symptoms of diabetes, which are being thirsty all the time. Like this thirst is unquenchable. Having to pee all the time, just being really tired. Having blurry vision, weight loss, kind of all the classic symptoms. And for a long time, well, I shouldn't say a long time, for a little while, I ignored them because I thought, I'm just not feeling well. It's the end of the quarter. I've been busy all quarter long. This will pass. And the other thing that was going on for me was, I had been studying French for a really long time, and it had been my dream to go to Paris and spend time in Paris. And I had several months prior to that, I got an internship in Paris for the summer, and I was scheduled to leave on, I forget, sometime in the middle of June of that year. And I thought to myself, if I go to the doctor's going to tell me that I can't go to France. And that was the last thing I wanted to do. So I put off going to the doctor forever, for longer than I probably should have. long story short, I got real sick, and I was just not doing well. And it was one day I was going to class, and I didn't collapse, but I was just I couldn't make it. I couldn't go any further. So I walked straight to the student health center, and they checked. I told them what was going on, and the symptoms sounded real familiar to them right away. So they took my blood sugar with a finger prick, and they on the screen on the meter, it said high, HI, which means my blood sugar was over 600, which is about 6 times what it should have been. So they took me to the hospital and ended up being diagnosed with type 1 diabetes that day, and have been living with it ever since. Well, actually, I've been living with it before that, but I had known about it and been living with it ever since that day. And by the way, I went to Paris 3 weeks after my diagnosis.
Oh, wow. So how do they determine, what needs to be there in order for them to diagnose you with type 1 diabetes? In order for them to do it that quickly, what factors need to be there for them to go, this is not type 2, or it's not that. This is what you're dealing with?
So, I mean, a couple of things. The real answer is my blood sugar was very, very, very high. And I don't know whether that, so in order to be diagnosed with type 1 diabetes, you have to have a high blood sugar. I mean, it's over, I think, the diagnostic criteria is over 126, which is actually not, I mean, compared to what I was, that's actually fairly low. And you also have to have the presence of an antibody in your body. It's called the GAD antibody, which is the antibody that attacks the cells in your pancreas that make insulin. And if those two things are present, then you have type 1 diabetes. I honestly don't know whether when I was in the hospital that day they did the antibody test. It's possible, but they may have also just said your blood sugar is extremely high and you're young and you kind of meet the criteria for having what we classically think of as type 1 diabetes. If people with type 2 diabetes, they have higher blood sugars as well. It's rare. Well, first of all, it would be rare for somebody that my age at that time, 21, and a college student in pretty good physical condition to be diagnosed with type 2 diabetes. Not unheard of, but fairly rare. Also, it'd be pretty rare to have a blood sugar of that being that high at diagnosis. Again, that it happens sometimes, but it's not particularly common. So I don't know exactly what tests I did, although I just know they took my blood sugar. And I think that when they took it in the hospital, it was something like 825 or so. So that I was, I was not doing well, and it's pretty clear that I had diabetes of some sort, and type 1 was probably the most likely cause. Actually, but now you make me curious as to whether or not they actually did the antibody test.
Yeah. So what's the difference between type 1 and type 2 diabetes? My dad has type 2 diabetes.
Yeah.
And he's fine. He's always kind of managed it with what he ate or what he didn't eat and maybe a pill or two over a period of time, but he self-manages that way. What's the difference?
Yeah, so type 1 diabetes is an autoimmune disorder. And what that means is that your immune system attacks part of your body. And so my immune system attacked my they attacked the beta cells of my pancreas, which are the cells that produce insulin. And basically, in real simple terms, kill them. So they don't do it. They don't produce insulin anymore. And so insulin is a hormone that allows that lowers your blood sugar. So when you eat, you eat carbohydrates. Carbohydrates break down into sugar in your blood, and that sugar needs to get into your cells in order to give you energy and in order for your body to function. And if that sugar can't get into your cells, it basically poisons your blood. And insulin is like a key that unlocks the cells and allows the sugar to come in. And so when you have type 1 diabetes, you don't produce insulin. It's like, it's like, think about it as a faucet, like in your bathroom. And you turn the faucet on and it drips, it pours out. And then when you have type 1 diabetes, the faucet just gets turned off and there's no more insulin coming out. And so in order to treat it, you have to take insulin from the outside. you have to either give yourself an injection or give yourself injections on a regular basis, or you have to wear an insulin pump, which is a machine that they look like pagers, kind of, with a tube attached to it that puts insulin into your body on a regular basis. So, and if you don't do that, you'll get very sick and die very quickly. If you don't take insulin with a couple of hours, you'll be in pretty bad shape. Type 2 diabetes, on the other hand, is a metabolic condition. And what that means is, it means that your body usually produces insulin, but it doesn't work as efficiently. So imagine that you have like a really high, like your body is like a really high efficiency sports car, and you're driving it and you're getting really good gas mileage. And then, but then after a while, you don't maintain it. You don't change the oil. I don't know how cars work, but you don't do what you're supposed to do to make sure the car is in good shape.
Yeah.
And then all of a sudden you go from getting 20 miles to the gallon to 10 miles to the gallon. So the car isn't working as efficiently as it could. So it's using more gas to go the same amount of distance. That's kind of like what type 2 diabetes is like. Your body's producing insulin, but it's not using it very well. And so your body has to produce more insulin. And as a result, your blood sugar goes up, because like you have this, if you have the same amount of insulin in your body and it's not using it as efficiently, yeah, you're not getting the full benefit of it. And then what happened? And there's a lot of and so you think about type 2 diabetes as being a disease of people who are lazy and overweight and all kinds of really negative things, and that's not really true. Certainly lifestyle plays a role in it. So people who are more physically active and who are thinner have a lower risk of developing type 2 diabetes, but it certainly doesn't take the risk away completely. And also there's a genetic component to it. So, if you have a family member who has type 2 diabetes, you're more likely to have type 2 diabetes, no matter what your other risk factors are. So with type 2 diabetes though, because your body is still producing insulin, you oftentimes don't even know you're sick. If your blood sugar right now is 200, which is about double what it should be, you probably wouldn't notice it. You may feel a little tired, or you may feel a little different, but it wouldn't really bother you a whole lot. And so people with type 2 diabetes they can live with it for a long time without actually knowing they have it. And then when they're diagnosed, which is usually by accident, by the way, they don't usually get real sick. They usually go to the doctor for some other reason, and they do a blood test and they say, oh, your blood sugar is higher, you have type 2 diabetes. Managing by losing weight, by eating healthier, being more active, can be really effective. There are also medications that you can take. But here's the thing, with type 2 diabetes, when it's kind of like, when your body starts going into overdrive and making more insulin to make up for the lack of insulin the inefficiency of the use of insulin that you have, eventually that faucet runs dry. Yeah. And the body stops producing insulin. And so it doesn't necessarily become type 1 diabetes because you don't have the stop in insulin production wasn't because of an autoimmune response. It was basically a response of like the pancreas is tired. It doesn't and can't do it anymore. But in the end, when that point hits, the diseases are functionally the same. They require that constant management. They require taking insulin. They require being hyper aware, because if you're taking insulin's a hormone that can be life-saving, but also that is life-saving, but also can be very dangerous if taken, in the wrong dose. Yeah. And so that's kind of that's that type 2 diabetes in a nutshell in comparison to type 1.
Yeah, my dad definitely has type 2.
Yeah. And I don't know your dad, but my guess is that, so with type 2 diabetes, it's real easy to kind of like say, I'm fine. Yeah, I don't need to pay attention to this because I'll take my pill in the morning and not really worry about it. Yeah. And he maybe, people with type 2 diabetes do that. Some of them are really healthy and some of them aren't, but they don't really know that they're not. Yeah. If I don't take care of myself, if I don't take insulin for my lunch today, I wouldn't be here right now talking to you. I would probably be in bed and not feeling well at all, because like my blood sugar would be sky high.
Okay.
So it's something that I have to pay attention to. And if I don't pay attention to it, like I'll know it real quick. With people with type 2 diabetes, that's part of the challenge is that they feel fine. And so why change something if I feel fine? Like if I want to have a hamburger and a French fries and a beer right now, or a Coke right now, like I feel fine. If I did that and I didn't take insulin, I wouldn't feel fine at all. Not at all.
That's awesome. All right, so let's digress a little bit. So how did you respond to your diagnosis? Emotionally, how did you respond with your lifestyle? What kind of change?
So, I mean, on the one hand, I was terrified. I was like, I have no idea what this means what this means for me, like what it means about my future. But at the same time, so I had an awesome doctor when I was diagnosed. And that was extremely important in my life because she told me, I mean, as I said before, the one thing I was most scared of was that the doctor would tell me, you can't go to France. And my doctor said, you can go to France. You can do whatever you want. I was like, I'm going in 2 weeks. She's like, no problem, go. And her telling me that, it took a big weight off of me. Not about managing my condition, but about what my condition means about me and what I can do and what I can't do. And so I think that my emotional response was actually fairly healthy because of that, because of her support and her encouragement and her empowerment. I have a feeling that if her response wasn't what it was, we probably wouldn't be sitting here talking right now, because I probably would have had a much more negative response. Think about it, if I would have been told, or I'm thinking about it, if I would have been told, you know what, your dream of going to France is dead, you're going to stay home all summer and do nothing, I would probably have been and would be right now really resentful. But luckily I wasn't, and I was empowered. And by the way, I went to France, I had a great time, but I knew nothing about diabetes. And I made some rookie mistakes, so some real big mistakes. And I survived, and I know worse for the wear. But looking back on it, it's kind of scary.
Pretty dangerous. Like what? Give me an example. Like, do you have one example that you have?
Yeah. So as I said, insulin's a dangerous drug, or it's a hormone, but a dangerous medication. And so diabetes is like a balancing act. You don't want your blood sugar to be too high, so you take insulin to bring your blood sugar down. But you also really don't want your blood sugar to be too low. Actually, low blood sugar is much, much more dangerous in the very short term than high blood sugar. Huh. You can live with a high blood sugar for a long time, and you'll develop complications eventually in like 5 or 10 years, or maybe shorter, but in a ways off. Oh, wow. But if your blood sugar is low, if you take too much insulin, you can pass out and die, in 5 minutes. It's very dangerous. So that's why people with diabetes are always carrying sugar and making sure they have sugar around, because if your blood sugar goes low, you feel it, and you eat sugar, you drink some juice, and you bring your blood sugar back up to normal, and that happens really quickly. And it's actually a fairly common thing. It happens. I have low blood sugars all the time, but I'm used to dealing with them. So as that background, so I was in France, and I didn't really realize that I needed to have sugar with me all the time. So I remember being in bed one night, like sleeping. I was living in a dorm type environment, and I woke up, and I was sweating and I was shaking, and I was feeling pretty weak, and I realized my blood sugar was low and I didn't have any sugar with me. So I go across the hall or downstairs to a vending machine. But here's the thing: is I just got to France, and I'm using francs at the time. It was before the euro. I didn't know how to count francs, especially when my blood sugar was low and I couldn't think straight. I had to figure out how to pay for this, how to pay for this Coke, and I couldn't figure out which coin was what coin was what, and how to actually work the machine. So looking back on that, I should have. I mean, what I know now is that you need to have sugar by your bed, and you need to do that. Or if you're going to need to buy a Coke in the middle of the night, you need to know how to count the money that you're going to use to buy the Coke.
Yeah.
So that's one example that I remember very well.
So when you got back home,
yeah,
seeing to beginning to take care of your life or starting to look at things a little bit different? How was that adjustment? I mean, you're in school. How did that all change? I mean, it obviously had to affect. Were you planning on being a psychologist for type 1 diabetics? I mean, from the beginning, or I'm assuming
Yeah.
there's an equal transition.
Yeah. So when I was in school, I studied political science. And so I like being a psychologist never even crossed my mind. And actually, even when I decided that I wanted to be a psychologist, so I'll be honest, I was kind of my path, and I can't really. I wish that I could say there was this aha moment when I knew what I wanted to do, and it was really more of a okay moment. Like I need to figure out what I'm going to do, and I don't really know what to do. But the year after I was diagnosed, I spent the summer working as an orientation counselor at UCLA, which was one of the funnest summers of my life. Like I had such a great time, made great friends, and like did what I felt was really meaningful work. And I love sitting with people and listening to their stories, and somehow in that process, like the idea of becoming a psychologist kind of came in my mind. Now, the funny thing is if you would tell me that right now, like if you would say, Mark, I'm thinking about being a psychologist, right? And I would say, Austin, why are you thinking about that? And you would say, because I love talking to people and hearing their stories. I would actually tell you that's the exact wrong reason to become a psychologist. because that's not really what the work is. That's part of it, but that's not what it's not about. Like sitting around having fun chatting all day long. But I think God was working with me in this way to kind of guide me in this direction. And then so I decided that's what I wanted to do, and so I had to have and to get into graduate school in psychology is a very competitive process. And there are very few spots for a large number of applicants. And so I needed a story. I needed like a reason why, this is why Mark should have this spot in graduate school. And I didn't have a story. So I used diabetes as my story. I was like, well, I have diabetes and, there are some people who don't cope well with diabetes. And so I'm going to help them. Not really knowing that that's what I would actually end up doing. It was really more of a story that I told as a way to kind of it was a means to an end as opposed to the end in itself. But it ended up being a self-fulfilling prophecy, which is ironic. I never had the intention of doing this. I was really using it as a way to achieve my goal. But then I started doing it, and I realized that one, I love it, and two, there's a big need that's not being met, and that I could help meet that need.
Very cool. Did your diet change much? I mean,
so that's a long story, but the answer is no. It didn't at that time, and that was a big. So there's a lot of controversy in the diabetes community about what a diet should be. And my doctor, and she's not my doctor anymore, but she's a great woman and very, very well respected. I remember very clearly her telling me, you can eat whatever you want. And I took that to heart. And probably not the best advice, to be honest. Because as a person with diabetes, you can eat whatever you want. However, it makes things a lot more challenging.
Consequences.
There are maybe not long-term consequences, but so if I go out and I have, anytime I go out and I have a bowl of pasta and a big Coke and an ice cream sundae for dessert, I could do that, but my blood sugar will go high and I probably won't feel well for a while. Yeah. No harm, no foul, but except for the fact that I don't feel well, and maybe even into the next day. And so but for the first 10 years I lived with diabetes, I kind of did what I wanted to do and dealt with it as it came, and didn't really think twice. And I also gained a lot of weight because insulin is also a fat storing hormone, and when your blood sugar is low, especially when you're eating whatever you want to, you have this your blood sugars go up and down and up and down, and when your blood sugars go up, you take insulin, which then brings your blood sugar down, which then means you have to eat sugar. or some sort of carbohydrate, then, and which is calorie ridden, right? And so I ended up gaining a lot of weight. And about 5 years ago, I realized that this wasn't working for me real well. I was spending lots of time like not feeling well. And this is after, by the way, after I became a psychologist doing this work. So trust me, being a professional in this industry doesn't actually, you aren't always like the best patient. I realized that if I actually ate fewer carbohydrates and lost weight, things would be much better. And so I ended up losing about 60 pounds, and I started eating a lot healthier and being much more mindful of of the types of food that I eat and how many carbohydrates I'm eating. And since then, like, I don't want to say life has been awesome, but I felt a lot better, and I haven't had those like days, or I've had a lot fewer days when I have not felt well at all, and I haven't been able to function as well as I wanted to. So now I'm actually really aware of what I eat, because I'm very in tune with my body, and I'm in tune with, if I do this, there's a consequence, and I have to make the decision whether or not I want that consequence. And sometimes I do. Sometimes I'm okay with it. If I'm on vacation and I want to have a pizza and an ice cream sundae, I do. But I also go into it with full eyes open, knowing that if I do that, then I need to be prepared. One, in terms of how I treat it, like how much insulin I take, when I take the insulin, all that stuff, as well as be prepared for not feeling well, which doesn't always happen, but sometimes does. So there are no hard and fast rules, but certainly if you eat lower carb, life is just easier.
Yeah. So how, I know that aging kind of in one form or another affects all of us, but how have you seen, even in cases in your patients and in yourself, how has the disease kind of evolved as you've gotten older, and or what kind of changes do you see take place in some of your older patients as they age, that the autoimmunity gets a little bit more difficult to, things just kind of start showing up, along with muscle aches and along with those kinds of things that slow your life down? You understand what I'm asking?
Kinda, yeah. So, I mean, with diabetes of itself, I don't see a lot of changes with age on its own. But there's a couple things that I do see. One is, complications. I have patients who are older, who've been living with diabetes for 30, 40, 50 years, and they have complications from diabetes, whether that's, some sort of eye disease or some sort of stomach problems, or, a variety of things. And that has to do with age, but also has to do with diabetes management, how long you've had diabetes for, things like that. The other thing is that, that diabetes, for some people, they have diabetes by itself, but autoimmune disorders tend to run together. So a lot of people with diabetes also have celiac disease, or they have thyroid condition, which are generally autoimmune. And they don't always come on at the same time. So some people will be diagnosed with diabetes when they're young, and then they're diagnosed with Hashimoto's, which is a thyroid condition, later in life. And so those things combined with each other can make things, challenging.
Yeah.
On the other hand, though, I will say, I love seeing people who are older, and working with people who are older who've had diabetes for a long time, because they appreciate the advances that we've made in treatment. So, in order to treat diabetes well, you have to be able to check your blood sugar to know what it is, to be able to know how much insulin to take and what to do. Up until the late 80s and early 90s, people didn't have blood sugar monitors at home. The technology just didn't exist, or if it did exist, it was too expensive. And now we have these machines called continuous glucose monitors, which are like little sensors you wear on your body, which go to your phone and flash a number on your phone all the time, and alarm when things are going, off base. So finger pricking is actually not, people do it still, but my guess is in 3 or 4 years, no one will be pricking their finger anymore, because you just look at your phone and see what your blood sugar is. Insulin pumps are pretty amazing, and how they work together, how they work with CGMs to like actually make adjustments to your doses. So that being said, people who've been living with diabetes for a long time, they love this stuff because for them it's revolutionary. For people that I work with who are younger, 18 to 25, this is just normal. It's kind of like you and me in cell phones, right? When I was in high school, I didn't have a cell phone. I didn't have a cell phone in college, and then I had a flip phone, and now we have these phones that like do amazing things, and I'm still amazed by it. But I guarantee you that my daughter and your son, when they're 18, they won't think twice about these phones. They're like, this is just normal, or they'll think the phones we have right now are ancient, because it's the same type of thing. So I love working with those folks because they love the technology so much, and they see the change in their management and their lives, and how much it's helped them.
How do the younger 18 to 25-year-olds with the technology that's almost expected, the rest of the life that the younger kids live, we all live with this kind of expectation, but I'd say if they aren't aware of the way that it was before, and kind of expect the technology to kind of do this side of it for them, if you will.
Yeah.
How is that younger generation with managing their illness and managing their type 1 diabetes? Do they do as well, or is there any difference or contrast between?
Yeah. So we can't speak for everybody, but I can talk about some like the biggest challenge. The biggest challenges sometimes are getting them to use technology. So let me explain. So imagine that you're an 18-year-old girl, and you're on summer break, right? And you have diabetes, but you want to go to the beach and you want to wear a bathing suit. And you don't want anyone to know that you have diabetes, because having diabetes is embarrassing for you, or it makes you different. And you want to be just one of the girls, or one of the guys for that matter. But it tends to be more prevalent. This issue tends to be more prevalent in girls. So they see the technology as they don't want to use it. They have it available to them, but they don't want to use it because they see the technology as being this like physical reminder of an invisible disease.
Yeah.
If I have to wear something that reminds me all the time physically on my body that I had this disease, I don't want to deal with it. I would rather pretend most of the time that I don't have it. And so it's not necessarily the technology and use of the technology or not, but it's more of the attitude that surrounds that. Yeah. That's the biggest challenge, because you don't need the technology to do well. It's certainly helpful, but you can do very well without the technology. But if you have the attitude of, I don't want to think about diabetes, I don't want to, and this technology, even though it would be helpful, it makes me, I have this thing on my body that reminds me, that attitude goes into the other parts of management. So, I'm at dinner with my friends and the French fries come. Am I going to pull out my insulin pen and take a shot? Well, no, because that would remind me, and that would draw attention to me and remind me that I have a disease. And so that's the biggest challenge. People who are older, who didn't have this stuff when they were younger, they love it, and they would never go without it they would do lots to not go without it, because they know what not having it's like. Yeah. And then now that they have it, they appreciate it a lot more.
Yeah. Wow. What are some of the? Well, no. I want to hear a little bit about the mental space in regards to having type 2 diabetes. How is there much anxiety and depression or anything like that with people who have type 1 diabetes? And how do you
type 1? Yeah.
Type 1 diabetes. How do you see it? And talk to me a little bit about that.
Yeah. So there's a lot of coexisting depression and anxiety. And I like to look at it on kind of like three different levels. So the first is just like negative emotions. So, which are normal for everybody, but, with diabetes, I think sometimes it can be a little bit more intense.
Yeah.
So, and I think that I've never met anybody with type 1 diabetes who doesn't have some level of negative emotions around their condition. Just like, and there are things that are like anger, frustration, confusion, annoyance. What's that?
Impatience with yourself?
Yeah, well, impatience with yourself, or impatience with the unpredictability of the condition. Because one thing about diabetes is that it's not a check in the box condition. Like, it's not a matter of, okay, if I take my medication every morning and I do these three things, then everything's going to be fine.
Yeah.
It's more of like, okay, well, I did this yesterday and it worked. I did the exact same thing today and it didn't work, or the outcome was different. Like, what's going on here? That's frustrating. That unpredictability can be really challenging, because like, you're doing the best that you can and the outcomes aren't what you expect them to be. So you kind of, and those happen for everybody. That's not something like, there's not that, and there's no way to really kind of change that. It's just our bodies work differently on a day-to-day basis, depending on, how stressed you are, and, if you're a woman, what time of the month it is, and, what's going on in your life and what you ate last night. There's just so many variables that go into how hot it is outside. They go into blood sugars. And so that frustration, annoyance, kind of those general kind of feelings are there, I think, for most people to some degree. Some people deal with them better than other people. Some people like cope with those things better and can kind of brush them off easier than other people, but those are there. On the next level that I think about are kind of these diabetes-specific challenges. So the biggest ones are called diabetes burnout and diabetes distress. So, and those are pretty much exactly what they sound like. So diabetes burnout, diabetes is a condition that requires constant management. There's no days off, and you have to do it all the time.
Yeah.
And people get burned out by it. If you have a job, and if you need a break, you take a vacation or take a sick day, and you don't think about work for the day, and you go and play golf. There's no breaks like that with diabetes. You can play golf, but you take diabetes on the golf course with you.
Yeah.
And that for some people that can burn you out, and they want to just ignore it either for some time or forever. And that's actually fairly common. And then diabetes distress is like, there's a couple different factors of diabetes distress. So one is just like, the constant stress of having a chronic condition, dealing with your doctors, dealing with your, parents, spouse, girlfriend, friends, dealing with the daily management tasks. But the thing about that, and people oftentimes mistake diabetes distress and depression. They confuse them. If you took diabetes away from the person, all of that stress would go away, and that wouldn't happen. With depression, certainly there's a relationship between diabetes and depression, but if you took diabetes away, the depression would still be there.
Yeah.
And that leads me to the third kind of the third area where the mental health stuff kind of comes in is anxiety and depression. So, you think about depression as being, in real simple terms, like worry about the past, like thinking about the past and kind of ruminating about the past, having a depressed mood, feelings of hopeless and helplessness. And diabetes can certainly bring those things on, but also it can exacerbate them if they already exist for you.
Yeah.
And they can make it really hard. They can also, when you're depressed, when you have depression, it's harder to manage diabetes. It's harder to kind of do those daily tasks. Anxiety, worry about the future. And with diabetes, there's a lot to worry about. Complications, kind of the social pressures, the people nagging you. There's lots of anxiety that's going on there. And so that can make that, so there's anxiety that's kind of just inherent in diabetes. And then there's also that anxiety that's inherent in life, which can make diabetes harder. And then there's a variety of other things, which we can talk about as much as you want to, that are kind of these diabetes-specific mental health challenges. So, for example, one is a fear of low blood sugar. So, as I said, diabetes is kind of like walking a tightrope. You don't want to be too high, but you don't want to be too low. there are some people who develop a fear of having low blood sugar. And so what they do is they end up avoiding a lot of activities that they think could lead to low blood sugar, or activities that if they had a low blood sugar while they were doing that activity, they feel like they'd be embarrassed or in danger. So things like riding their bike or playing basketball, giving a speech. People have fears that if I have a low blood sugar doing these events, something awful is going to happen.
Yeah.
And so they go to great lengths to avoid either the activity or the low blood sugar, by keeping their blood sugar high, or by just not doing the thing they want to do. So keeping your blood sugar high is bad because it's not healthy for you. And then avoiding these things that you want to do, it really impacts your quality of life. Like if you kind of take this to think about, like, in terms of dating. I always make these relationships in terms of dating, or these like metaphors. If you were scared that if you're out with that girl that you really liked and you had a low blood sugar, you're either going to keep your blood sugar really high, or you're not going to go out with her. And neither one of those is great options, right? You're going to go out there and feel like crap, or you're going to like just avoid the date altogether and just say, I can't go, and like be all alone. And that's an example of what happens, but that happens in lots of areas. And so working with people, and that's a very diabetes specific concern. And there's a mental health condition that's specific to people with diabetes. The other one that comes to mind, which is a lot more complicated, is diabetes-related bulimia. So bulimia is an eating disorder that's characterized by binging and purging. So you binging food and then finding some way to get rid of it, whether that's using a laxative, whether that's vomiting. So one thing that people do, more often than we want them to, is they don't take insulin in order to lose weight. So if you stop taking insulin, you will lose 5 pounds in a day, just because your body can't store any kind of fat, and your body starts burning fat and muscle in order to survive. Yeah. And so people come to this realization, and remember that diabetes is also a very body. There's a lot of body image issues related to diabetes. So people who have diabetes, sometimes are a little. They gain weight easier because of a lot of factors. They're very conscious of what they look like because they may be wearing a device, or they may be having to prick their finger, things like that. And so there's a number of people who use insulin omission as a way to lose weight, which is very, very dangerous, but it's also one of those things that's very diabetes specific. And those are the types of things that I deal with in my work, is helping people who have these conditions that are like, if you heard about that, or if a general psychologist heard about that, they wouldn't have any idea first of all, what the issue is, and second of all, how to deal with it. And that's kind of what I specialize in.
That's awesome. I'd say everything we just talked about right there is probably the most commonality I'd say our illnesses have between each other.
Yeah.
And how, because all of those are totally relevant to everybody with Crohn's, and how you deal with it, and your headspace and the anxiety with having it. Like one of the number one side effects of people with Crohn's disease is anorexia. Mm-hmm. Bulimia isn't too far behind for that same reason. They just don't want it to get to the digestive system where the body's using it and sets everything up. I mean, you can rather suffer the consequence of being hungry than dealing with the consequence of eating and digestion. And the medications you take for autoimmunity cause all kinds of body image issues.
Right.
Depending on inflammation, things like that, you're on steroids and things that give you moon face. You're on these other things that might make you sweat. You might get sores. There's so many things that then you either choose to, you almost have to choose to just kind of own it as it is, or become loose in a lot of ways.
Right.
You really kind of begin to manage this and live with it, or you base all your decisions based on how many people you're going to see, who's going to be around, and how much control I have over that particular environment.
Right.
And that is I've been there, man, and that's a terrible place to be. That's
Yeah.
it's a hard place to be.
Yeah. And you know what, in my experience, my professional experience, people, I would say the majority of people who come to me to see me in my practice and who I work with, they want the answer. They say, I'm going to come see a psychologist and he's going to tell me what to do to not feel burnout. He's going to tell me what to do to not feel anxious about my low blood sugar. He's going to tell me what to do to feel better. And the first thing I tell people when they come to see me is, I don't have that magic bullet. I don't have that pill or that piece of advice that I can give you that's going to make you feel better. We're going to work together to hopefully make you feel better, but it may not be in the way that you think that it's going to happen. Because the reality is that having diabetes or having Crohn's disease is tough. And there's not, and I just mean like the daily management, the physical feelings, the embarrassment, all that stuff is tough. Yep. And you can either do one of two things. You have one or two choices. One is you can say, this is tough and therefore I'm not going to do it. Or I'm going to make it as easy as possible. But what does that mean? It means staying home. It means not doing the things that you want to do. It means kind of being a recluse and not living your life.
Yeah.
The other option, and I'm simplifying this to some degree, but the other option is to say, screw it. I'm going to go out and I'm going to live my life. And I recognize that I'm going to be embarrassed sometimes. I'm not going to feel well sometimes. I'm going to feel burnout sometimes, but I'm going to do it anyway. And because I have the ability to tolerate the fact that I'm uncomfortable. And I can tolerate that distress, and I can live my life even with that distress.
Yeah. And
what people generally find when they're able to do that is that the distress actually goes down. You know, if you're scared to ask the girl out on a date, and that keeps you from doing it, well, guess what? You're still scared to ask a girl on a date. Yeah. You've avoided doing it, but that doesn't make the fear has gone away.
Yeah.
If you ask a girl on a date, and even if she says no, and she says hell no, I'm not going out with you. You're hurt, but you recognize that you can handle the hurt, and nothing horrible happened. Yeah. If she says yes, then you recognize, oh, that was really scary, but I have the ability to do it. Yeah. And the same thing is true for like living life with these conditions. You know, you may be embarrassed because your ostomy bag is full, or you have to change it, or it's leaking. You may be embarrassed because I may be embarrassed because my blood sugar is low and I'm acting a little stupid. But the reality is that I'm also no worse for the wear after it's done. Like, you know, yes, maybe someone looked at me and they laughed at me. Well, you know, so what? Maybe someone saw you and they were wondering what's wrong with that guy. But in the end, so what? And I don't mean to minimize those like feelings of embarrassment, but the reality is that we can handle a lot more than we think we can. Yeah. And if we're willing to handle it and willing to feel uncomfortable, then we're going to be able to have a lot more flexibility in our lives, in our world. And that's really what this is about. It's not about making the feelings go away. It's about allowing ourselves to be flexible with the feelings and with the condition. And that's what our work's all about.
And learning to be okay, not being okay. Learning to be okay with not being okay it can sound corny, it can sound easy to say, hard to do, but it's one of those things that as I began to repeat that over the years, I mean, you read my story, so you could see my struggle emotionally with accepting my illness, adjusting my life to it. But it took years of me trying and falling and quitting, and staying home for another month or a month and a half, and then trying again and falling and getting hurt even more and staying home for 2 months or whatever it was, until eventually I couldn't get hurt anymore almost.
Yeah.
Eventually just got to the point where I was like, holy cow, man, all I'm doing is going out. I get whacked in the face once emotionally with something, and I go and I quit. And eventually I I built up emotional calluses, and that's what really kind of had to begin to grow. And you see that kind of in my story as I wrote it, but it took years. It wasn't something that was quick. It wasn't easy. And I quit as many times as I tried to quit smoking when I was doing that until I eventually went cold turkey and was done. I had to quit over and over.
Yeah.
And that's what I did with accepting the illness and dealing with it and building up an immunity, if you will, to caring so much about trying to feel perfect, trying to feel okay, and having other people see that I am maybe a little abnormal and have something going on.
Well, and people always say, well, why would I want to suffer? And I say, well, you don't. But the thing is, if there was a solution to this problem, then by all means use it.
Yeah.
I mean, don't mishear me and think that I'm saying like, you should just like suffer for the sake of suffering here. Like, don't take your medication. Do everything you got to do to feel good. Do everything you got to do to take care of yourself, and hopefully that'll be successful. But the thing is, like with our emotions, with our physical, with our diseases, there are things that we can do and that we should be doing to take care of ourselves, right? I take insulin, you take your medication, you change your ostomy bag, I change my insulin pump site. Like those are all things that I can do and that are healthy for me. But if we take the same attitude of like, I'm going to do this check in the box with our emotions. And here's the thing, when we do that, we usually end up even more frustrated because you say, I don't know about you, but I can't say, Austin, I want you right now to be very, very happy.
Yeah.
I can't tell you how to feel. And honestly, you can't tell yourself how to feel either.
Right.
That's not how it works. But we have an expectation that that you should be able, that I should be able to do that for you, or that you should be able to do that for yourself. Yeah. And what ends up happening is then you get pissed off because it doesn't work. And what do? You double down. You keep trying harder, and you get even more pissed off.
Yeah. And
so this is about, it's the serenity prayer. Lord, help me to change the things that I can and accept the things that I can't. And that's exactly what this is about. It's about, recognizing that there's some things that I have no control over, including my emotions sometimes. And to be okay with that and to move forward and to live in the world despite that.
Yeah.
Not allow that to drive what I do and what I'm willing to do.
What are some of, and maybe you might have to think about it for a second, what are some of the backup plans that you kind of have built into your life? For people who are new with it, with diabetes, you and I could tell in my daily life, I've got a number of I got people all over the town I can call, swing by their house. I've got everything, several little packs of stuff in my car, at my office.
Yeah.
Like, what are some cool little handy backup plans that you kind of have or need to have, or you see that are common?
Yeah, I mean, for people with diabetes, and for me, I always have sugar in my bag. I always have sugar in my car. I always have a couple of dollars in my pocket so that I can buy something if I need to. Yeah. I always have extra insulin with me in a variety of places. My wife always has extra insulin with her.
Yeah.
Just because, I've been in, so I mean, it's kind of like having the supplies ready. I have people, I'm lucky that I have a great network of people with diabetes around the country who I know who I can call if I have, if I need something, or if I need someone to listen to me talk and support me when things are rough. But I've also been on the flip side where probably like you have, where I've been caught empty-handed. I'll tell you what the best story on this. I'm embarrassed to talk about this, but
I want it. That's what I'm talking about.
Yeah. So I've known my wife now for a little over 9 years, and so I met her parents one time. So after we started dating, a couple of months after we started dating, she invited me to come home with her to meet her parents. So I did. We had a nice visit. And then the next time I met them was after we had gotten engaged, and her brother was getting married in Hawaii, and so so we all flew over to Hawaii, and her and I went over there and met her parents there, and so they were new to me still because I'd only met them once, And we were at this hotel, and I jumped in the swimming pool at the hotel with my insulin pump on, which is not recommended. And my insulin pump died. Like it literally just shut off.
Okay.
Which, if I was prepared, wouldn't have been a big deal. But I wasn't prepared. So there are two types of insulin. One is insulin that works real fast, so you take it when you eat. And then the other type of insulin is called long-acting insulin. And it basically is like insulin that's in the background of insulin in the background of your body, and it keeps your blood sugar stable over time. Well, I didn't have any backup long-acting insulin. I only had short-acting insulin that goes on my insulin pump. And my insulin pump wasn't working. And usually the pump company will overnight you a new insulin pump.
Yeah.
But this happened on a Saturday. I think it happened on a Saturday night of a holiday weekend. And so in Hawaii. Oh, and so so they couldn't get me a new pump for like 3 days. So, but the thing is, I didn't have any extra insulin syringes because I was using a pump. And so I didn't have any syringes. So I had to go like scour the island of Oahu to find insulin syringes. And then I had to take insulin every hour. I had to get up and give myself a shot, even in the middle of the night. And like, they must have thought I was the most irresponsible person in the world. Like I know that they were already worried about me marrying their daughter because I had diabetes. Yeah. I mean that's common. You know, why would you marry someone who has this illness, right? And which is, you know, it's a silly concern. But then they see me like trying to like basically stay alive. And I'm not sure how much they know, but how much they knew at that time about what was happening for me. But man, I was so self-conscious, and so it made the trip pretty miserable. Yeah. Because like I was like, if only I was more responsible, if only I was prepared, if only I would have like, you know, thought ahead and brought some syringes, bought some long-acting insulin, just had a backup plan. Yeah. But I didn't, and you know, I'll never forget that weekend.
Oh my goodness. I've only, you know, I've forgotten bags. I've run into situations where I was changing products, and I've been out of town and ran into not having stuff. But I'd have to say, man, the absolute worst was when I was at a buddy's wedding that I was in, and the wedding was 20 minutes before this wedding was going to start. I'm in the wedding, and I brought the wrong bags with me.
Oh no!
And I only had, and I didn't realize it at the time. I brought the wrong size bags, and all I had on me was what the easiest. It's a disposable one, so you use it once and you throw it out rather than draining it. And so the wedding is about to start, obviously. And I had to go to the bathroom, and I needed to change my bag. And this whole time I'm thinking I have plenty in my pocket. Everything's good. I'm just got to run to the restroom really quick before I got to do my thing with the groomsmen. And I go to the bathroom, and I take it off and lay it down and clean it all up. And I reach in my pocket to grab my other one and open it up. And I realize, oh my gosh, I don't have another one to put on, and this is off, and that's, oh my gosh, I'm gonna be in this wedding, holy crap, and all, you know what, you wanna talk about being embarrassed? I got embarrassing stories for you, but this isn't a drainable pouch, so what I had to do was I had to drain that thing as best as I could through the opening that was there. And wipe it up and reuse it and put it back on. And I swear it was early on after I'd gotten my ostomy. And one of the psychological things that was going on in my head was that I always thought I could smell it. No matter what, you always think you can smell it, even when you can't. Like I'd ask my wife, you know, can you smell anything? She's like, no, Austin, stop worrying. I'm like, I swear I smell something. But like the whole wedding, I was like, oh my gosh. I hope no one smells. Oh my goodness. but it was just so embarrassing. And I was stressing and emotionally. That's the kind of stuff that just beat me up because I was like, nobody else in my life has to deal with this crap.
Yeah. And I bet you the more, for me at least, and I'm guessing for you, the most stressful part of that is that that's something that could have been prevented.
Yeah, yeah.
If I would have thought ahead and done what I probably should have done, that stress wouldn't have been there. And so so I guess back to the distress tolerance. Like those are you want to be prepared and you want to do everything you can to minimize that stress.
Yeah.
But at the same time, those logistical things aside, there are going to be some times when you were prepared, you did everything right, and you just feel like crap.
Yeah.
Or something else is going wrong. And I mean, I think we need to be kind to ourselves all the time.
Yeah.
And kind to ourselves when we make stupid mistakes, and also kind to ourselves when like just everything's going wrong, but we did everything right. And that kindness is, it's just so critical.
Being able to see that kind of stuff in myself has softened me up and made me way more empathetic in situations where other people are incredibly vulnerable or embarrassed. And I'm a pretty hard person. I have a hard personality. It comes. All my family's kind of that way. But I'll tell you what, I've just softened up in regards to seeing someone else in distress or suffering or embarrassment or whatever it is, and I wouldn't have it unless I've been there. Unless I can like put myself right in their shoes and go, oh my gosh.
Well, yeah. And a lot of the people that I see in my work, their families and their friends, I can't tell you how many people I've seen they're usually in their early 20s, whose parents are all over them because just take care of yourself, just do these things, just like check these boxes and take in, and they don't understand that part of it is like really simple and part of it's really easy. Okay, just do these things, great, but there are lots of barriers to doing them. So again, and barriers like embarrassment. I can say, go make sure you have your blood glucose meter with you everywhere you go, and that you have an insulin pen everywhere you go. But again, if you're out on that date and pulling that stuff out of your pocket on your date and having to have that discussion about what diabetes is when you're just meeting somebody new, that's a barrier. And so it makes that one thing that seems so simple a lot more complicated. And so the kindness, I think, goes from both people who are in vulnerable situations, but also recognizing that it's like there's a perception on the part of outsiders, but also including people who really should be on the inside, that this isn't that hard. And on paper it's not, but in the reality of life, it's incredibly hard.
Yeah. I always hated dating just because I felt like it was a period of time. I was so insecure about my illness that I wouldn't disclose it to anybody until so much later. And I always felt like relationships were a period of time. It wasn't courting, getting to know if you love somebody, seeing if you were meant to be together, whether you wanted to spend the rest of your lives together. It was, I needed to find out if this person was trustworthy enough for me to slowly tell them about myself and all my problems. And if by the time we get there and they know everything, do they still like me and will they still stick around? Kind of. Yeah. And I'll tell you what, man, if I would have known any better, I would have realized how great of a filter I was given if I'd have disclosed it right up front, learned basically really quickly those who will and won't or do or don't want to hurt me, and be done with it. But my goodness, I can relate very much. Hey, so last thing I kind of want to touch on really quick is the resources, different resources for people that have type 1 diabetes, where it sounds like, so one of the things that I'm doing here in Wichita is starting a support group called Inflammation Nation for people dealing with IBS, IBD, Crohn's, and colitis. And a real support group where now it's going to have its a literal local real presence, physical presence, but it's going to be very much an online social media connector for people who are dealing with this, whether it's parents of people dealing with Crohn's or whatever it may be. And so I'm one of the number one things that is common with everybody I talk to that's dealing with this is that there's just this loneliness and their suffering and loneliness in dealing with what they're dealing with, because you either hide it or it's such an invisible disease that it's hard to talk about it. And it's hard to constantly have something that is a problem on the tip of your tongue all the time to drive people nuts. And so the support group, I think this is going to be incredibly powerful. What things are there like that for people with type 1 diabetes? And
and support is so important. It's probably the biggest intervention that we can offer people to deal with the emotional burden of diabetes is social support, knowing they're not alone. And it amazes me that when I see a patient, it's not uncommon at all for me to be the first person with diabetes that they've ever met or they've ever interacted with, which I'm glad that they're here with me, but I'm also, my goal is to connect with the people they can have support with on a social level all the time, as much as they want. Luckily, the diabetes community is wonderful. We have a lot of support resources. Certainly, we have in-person support groups, JDRF, and there's local organizations that do in-person support. But I also think that there are tons of online resources for people with diabetes to get support. And that support can either be like, chatting with somebody either in person on the phone or over text about diabetes. But also I think that we need to really kind of broaden our definition of what support means. So there are lots of blogs, reading a blog post about someone's experience with diabetes and just seeing that, they know that happens to them too. Like, I'm not the only person that happens to, and they feel that way too. That can be amazing. Reading a tweet, reading Facebook groups, things like that. My favorite resources for people online are there's a website called Beyond Type 1. Beyond Type 1 is a fantastic organization. I'm on their scientific advisory board, but they were started by Nick Jonas and a couple of other celebrities with type 1 diabetes who donated some money to start this organization. And they have a website that has tons of resources about diabetes, about living life with diabetes, whether it's, how to drink alcohol with diabetes, how to smoke pot with diabetes. I mean, they have a no holds bar approach about, what kind of resources are there, because they know people want to live their lives with diabetes, and they want to live kind of normal lives, whether those are healthy or not. Not my place to say, but just like, it's really, they have a lot of great information. They also have a great social community. They have, I think, over 1 million Facebook followers, and they're posting on Facebook constantly. Also, there's an organization called, there's a website called To Diabetes, TUdiabetes.org, which is it's a message board for people with diabetes. So there's all kinds of different, forums about you can get go in and like have conversations with other people with diabetes and really not feel alone. And then on Twitter or Instagram, there's a huge community of people with diabetes posting every day under the hashtags of hashtag T1D, hashtag type 1 diabetes, hashtag T1D looks like me, and so a lot of people are getting a lot of support, especially on Instagram, for diabetes. That's kind of a new world to me, but it's a pretty amazing place.
Where can listeners find you?
Well, they can go to my website, www.cdmh.org, Center for Diabetes and Mental Health, so cdmh.org. I just started an Instagram account. I have 3 posts up right now, and I'm the Diabetes Psychologist. And then on Twitter, they can find me at Diabetic Psych, at Diabetic Psych.
Okay, very cool. Well, Mark, guess what, man? It's still recording, and we got it all. And so I am super thankful for you being patient with me getting this done, and I'm thankful for everyone who's listening. Please subscribe to the Ostomy Guy page, and check us out on Facebook and Twitter and Instagram, and like us and follow us. We're really trying to get the word out to connect people and to give a little bit more peace of mind to those dealing with these issues and their family and their friends, to kind of see the normalcy of living with these illnesses. So I appreciate everyone who's listening.
Hey everybody, go to my website, theostomyguy.com. Order my book, Memoirs of a Bagman, The Ostomy Guy Story. There's a button on there that says buy now. It'll take you to Amazon, or you can go straight to amazon.com. Memoirs of a Bagman, The Ostomy Guy Story. Check it out.